So good morning, everyone. My name is Claire Timon. I'm a research fellow working in the school and the Centre for Integrated Care. And today I'm going to give an overview of the NEX project, which some of you may be familiar of. And I'm working on this alongside Katrina Murphy and Pamela Hussey and other academic collaborators within the university as well. So it's School of Psychology and the Insight Centre for Data Analytics as well. And this project is funded through Enterprise Ireland through the DTIF funding. And alongside that, we are working with two industry collaborators, Davra and Donalto, to complete this project. So just as a bit of background, I'm sure I don't really need to say it, but we're all aware we're living in an ageing population. And as a result of this, we really need to think of new and innovative and efficient, I suppose, ways to provide help and social support to older adults that allows them to maintain independence without compromising of quality of life and safety. And this is hopefully where the NEX project can contribute. So I suppose the overall aim of NEX is to use Internet of Things technology to offer unobtrusive health and wellness monitoring and then applying, I suppose, machine learning algorithms to that, which can help us identify and predict changes in the routines of older adults and in their own home environments. So really creating an opportunity for intervention there. So as I said, before I begin describing the project in more detail and what those kind of technologies look like, I'd like to share a brief animation which describes that in much better detail. And it'll give an overview, I suppose, of all the research efforts. And I think we've received this funding to generate this animation from one of the calls from the research committee funding calls. So it's been really useful for us for recruitment and for dissemination purposes as well. So I think it's really nice to be able to showcase this today, or will hopefully showcase it today. We tried earlier, but I'll just double check that. Yeah, okay.
Just make sure your sound is up there as well.
Yeah.
The NEX project is being developed at DCU with industry partners Davra and Donalto as a technology-based system for supporting older adults so that they can live independently in their own homes for as long as possible. To help us ensure that the NEX system can accomplish this, we've worked with older adults, caregivers, and healthcare professionals to help us identify the needs of older adults living at home. Our system consists of different technologies that will work together to support older adults and their caregivers. A voice assistant can help with various day-to-day tasks, for example, reminding you to take your medication. You can command it by speaking, and the assistant will carry out the commands. Sensors can detect activities and environmental information in your home. Information from these sensors create a picture of your activity and life within your home over short or longer periods of time. Wearable devices collect information on physical activity and sleep and provide feedback to the wearer. Some wearable devices can link with sensors in your home to identify the actions of different people that live there. The NEX system has the potential to enable older adults to remain living independently at home for longer and to facilitate caregiving support in a non-intrusive manner. If you're interested in participating in the NEX system trials or would like to find out more, contact NEX at dcu.ie or call 089 265 3951.
That's great that worked. I'll just remove it now. So thanks again for the committee funding to be able to develop that. It's been really useful, and we've shared it everywhere on social media for our recruitment efforts. So you may come across it on social media. So just to talk about the structure of the project a little bit more, I'll just scroll down here. It's very kind of text heavy, so I apologise for that. But this is actually an abstract that we presented at the Engaging Aging conference this year. So the project itself is structured into three distinct phases. Phase one we call the user needs and requirements stage, and this is where we kind of focused on working with stakeholders, so older adults and other stakeholders, to inform the design of the system. Phase two, we refer to it as a friendly trial, but this really involved piloting, I suppose, the initial ideas that came out of phase one trying to look at various types of technology, what works, what doesn't work. And I suppose the technology partners are very much focusing on how that all integrates together. So that was phase 2. And lastly, phase 3, which we're just about to embark on now, we call the Action Research Cycle Trial, or the ARC trial. And this involves trialing, I suppose, the refined version of the NEX system. So as a result of phase 2 and that pilot testing, there was, a lot of things that we had to change or reconsider. And we've, successfully done that now, working with all of our collaborators. And we're now ready to trial it on a much larger phase. So we're hoping to start that now, please God, in January. Hopefully nothing restrictions or anything will impact on that further. So just to touch on each of the phases and briefly on what we've kind of found to date. So phase 1, as I said, the user needs requirements study. This was a co-design approach, and it very much focused on partnering with end users to design the NEX system technology. And for this work, we reached out to older adults, obviously, but also to family caregivers, healthcare professionals and home support workers as well to be involved in this. Like everybody, our original plan for research, I suppose, was impacted with COVID. Our original plan was to conduct loads of face-to-face workshops with all of these stakeholder groups to explore their needs and, I suppose, the possibilities that technology can bring to their lives and the usefulness of it. But however, we had to adapt with COVID, and we moved kind of online, and we created an online survey which we disseminated to all stakeholder groups. And then we also, using the findings from the survey, we held some Zoom online workshops with those caregivers to kind of tease out some more of the findings there. So overall, we had over 400 people take part in those in a combination of those activities, and older adults were obviously the largest stakeholder group there, with over 265 participants take part in a combination of the survey work and the online workshops. So in terms of the key findings from all that, we discovered that the majority of our older adult respondents, they were willing to use technology to assist them to live independently in the future, and that they were kind of, technologies themselves are deemed most useful where they had a function to, I suppose, create an emergency response, to support home security and to assist with communication. So this was from the older adults' perspective. In terms of the key advantages to using technology, these included, them having increased independence and increased safety, while some of the disadvantages included financial investment and concerns about data privacy as well. So these were kind of themes that we saw come up again and again in the various groups that we talked to. From the other stakeholders' perspectives then, I suppose from a family caregiver perspective, remote monitoring of family members was one of the key kind of advantages or usefulness for technology from their perspective. From healthcare professionals, they saw technology being really important for communicating with clients. And then for home support workers, they thought technology could really help in terms of fall support. So we were able to kind of use all this information then to map, I suppose, the user needs to technological solutions, which, as you saw in the video there, kind of ultimately informed the NEX system design. So we identified, I suppose, communication safety and then real-time remote monitoring as key user needs. And to address these, we embarked on using voice-activated assistants, wearable devices for alert functioning, and then ambient sensors and smart plugs for real-time monitoring. And these have ultimately formed the kind of main components of the NEX system design. So then moving on to the next phase of the project, which was called the friendly trial, and as I said, that was the kind of the pilot phase of the first technology system. So to achieve this kind of testing, we recruited 7 older adults, and when I say older adults, we were looking for people aged 60 years and over, and we were asking them to install the NEX system in their homes for a duration of 10 weeks. So to be kind of interacting with the technology as much as kind of they wanted to, I suppose, but also we had some set activities in terms of collecting some ground truth data to see how useful that this technology was. Again, COVID-19 restrictions impacted our original study design. So originally our technical partners were going to go in and install the system, but obviously older adults being, you know, one of the most vulnerable cohorts, it wasn't appropriate or possible to go into anybody's home. So to overcome this, we redesigned the trial to be a self-installation. So we actually had 6 older adults self-install this system, which, when you look at some of the individual components of the technology, was actually really impressive that they were able to do that. We did offer remote support, and there was video training materials provided as well. But it was a big undertaking. So we did some home configuration assessments with them over Zoom to try and figure out where the best placement of technologies were. So these kind of contact sensors that would indicate whether somebody is opening and closing a press or opening and closing a door. We did some kind of assessments to figure out where the best places to put those technologies were. And then once everything was pre-configured by our technology partner, so everything was pre-configured to function off the user's Wi-Fi and everything like that, the technology was sent to them in their home for self-install. So participants trialled an alert testing via a wearable device. They provided information on their previous day's activities as a means of ground truth, so that we could compare the data from the system to the participants' report of their own activity. And then we asked participants to view their own data collected by the system and give us their feedback on this data as well. And then at the end of the trial, technology was removed, and we did what was called a process evaluation interview. And again, this was over Zoom. So after the 10 weeks of testing, what did we find? Well, successfully 6 participants installed the NEX system technology in their home with remote support. However, one participant withdrew from the study, highlighting the self-install or the complexity of it as the main reason. We found that participants were very open to adopting the NEX system if it meant that it supported, I suppose, their ability to live independently at home for longer, therefore postponing potential entry into any residential care. And so far, the system, I suppose, has allowed us to collect really rich and extensive health and activity data from users in their home environment, which was a great finding. You know, the technology for the most part worked. However, there were aspects of the current design that we needed to improve on, so to enhance kind of adoption. So as we said, the complexity of the self-install, the battery life of some of the sensors was problematic, and then the user acceptability of the wearable device for the alert testing was pretty low, so we had to review that again. And when we looked at what participants thought when they looked at the kind of system data, we could see, I suppose, that there was potential to be the ability to view your own data was a really powerful mechanism of action, which was impact on users' acceptance as well, and the adoption of NEX. So from a design perspective going forward, we really kind of carefully need to consider how we're going to present that data as well. So as I said, we're just about to embark on the final phase, which is the ARC trial. So we've taken all the feedback now from the pilot, we've made all the changes that we can, and we're now asking 30 older adults to install the refined system in their home for a period of 10 weeks. So a key objective of this research study focuses on using the NEX system to collect data for the identification of patterns of typical behaviour, which is referred to as periodicity, and then the identification of activities of daily living. So in the pilot trial, we looked at with the contact sensors, could we identify instances of eating occasions using various kind of data analytic approaches, and we were kind of successfully able to do that. So for the ARC trial now, we want to expand that further, looking at different activities of daily living, so looking at dressing and bathing and so on. So as I said, we're looking to recruit 30 older adults for this trial, and the majority of study visits again will probably be over Zoom, but however the system will be installed by a technician for this trial. So we're aiming to investigate participants' engagement with the system by completing interviews, and then their experience of using NEX as well, looking at acceptability and usability. And then for a small number of participants, we aim to recruit their caregivers to investigate, I suppose, the perceived usefulness of the data that could be collected by a NEX system in assisting them with their provision of care for older adults as well. So as I said, hopefully kicking that trial off in January. So lastly, just to conclude then, I suppose the NEX system or the NEX project has considered the specific everyday needs of older adults and other stakeholders, which has contributed to the design of this integrated system. The innovation of the NEX system really lies in using these Internet of Things technologies and artificial intelligence to predict changes in routines in older adults. And then lastly, I suppose the findings of this overall project will contribute to eHealth research agenda, focusing on the improvement of health provision and patient support in home and community environments. And thank you very much for your attention. Any questions?